Hi there, and welcome to Canceling COVID. I'm Tanya Rivens. Thank you so much for tuning in on this Tuesday. Canceling COVID back at you for another season. And we're just excited that you've taken the time to join us on this Tuesday. A little chilly outside, but we've got great information and we've got the same goal to keep you educated and to keep you informed. We're so grateful for our sponsors, Mecklenburg County Public Health, back with us again, making sure that you're informed and you're getting the information you need, as well as Groundwater Solutions. We'll give out their email address, actually their website, MECGovNC. Let me get that right. It's mecnc.gov. Again, that's mecnc.gov. And for Groundwater Solutions, their website is groundwater-solutions.org. I'll get it memorized and we'll get it up for you as well. But we've got a really exciting program today because it's all about informing you, and it's great that you take the time to tune in to try to get answers to some of these questions. We're about grassroots folks. And it's like people like you and I that just have questions, want information. And it's tough to get to these resources sometimes because they're so busy working, serving us and really trying. And I always kind of get tickled. I even just laugh to myself when people start criticizing and they don't know, and they don't, well, no, they don't actually always know the right answers because this is uncharted territory. So they're working through it, and it's a way that we can show appreciation by at least trying to be receptive as they're working to try to serve us. Now, a couple of numbers real quick. On January 4th, of course, the CDC and Mecklenburg County Public Health documenting the cases of Omicron variant is the leading case that has been contributing to the spike in COVID. Over 198,000 cases in Mecklenburg County, over 198,000. Those are some staggering numbers. And one of the most popular words now is unprecedented, but it is historical what we're dealing with right now. And looks like we had, as of January 4th, 1,326 deaths in Mecklenburg County. Well, here's the thing. We've got an opportunity. The vaccine works. And if you're not going to get vaccinated, there are precautions that are out there. All reports are showing nationally as well as locally, it's the unvaccinated that are being hospitalized. And that's really unfortunate. And I know someone, I was really surprised, that just caught the case of COVID and was not vaccinated and had a really tough time with it. So, folks, we got to at least, if you're not going to get vaccinated, think about your neighbor. I've said that all along, and I'll continue to say that. Now, we are seeing everything impacted as we've been dealing with now for 2 years, whether it is our businesses, our healthcare systems, our finances, you name it, our transportation, public transportation system. Charlotte, Mecklenburg now, because of staffing shortages, have had to make adjustments around public transit. Think about the people that rely on this to get to work. And we can't forget our babies, Charlotte Mecklenburg schools, and how they are having to adapt and make these changes. I see you guys hopping on. Drop your comments in and we'll share them. I've got a very special guest on here today, and I shared with her. I so appreciate her because she's there every time I call on her. And she is out working hard. And she's like, Tanya, I can squeeze you in. That's some good stuff right there. Somebody that's really trying to help educate the community. I'm talking about Miss Elyse Dashew. She is the Charlotte Mecklenburg School board chairperson. And again, thank you always for taking the time to talk with me, and just thank you for what you're doing to serve our students. So good morning to you.
Hi, Tanya. I just want to make sure you can hear me and understand me, because when I hear your voice, it's super, super slowed down. So I can't really understand what you're saying.
I know you have headphones on, so earphones on, but yeah, I can hear you just fine.
You can hear me okay?
Yeah, absolutely. I sure can.
Okay. Well, I can't really understand what you're saying, but I'm kind of making it out.
Okay. Well, let's try and work through this. I know you kind of had to make some adjustments, and we'll just follow kind of what we had talked about, which is, let's talk about how many students. The report I saw was more than 1,200 students were absent yesterday, 600 staff. Has that number increased as far as how many, how you guys are being impacted at Charlotte Mecklenburg schools?
I'm sorry, I cannot understand what you're saying. Should I try to leave and come back in?
Or can you hear, maybe if you unplug your earphones? Let's see if that works. Okay, what about now?
It's not.
Yeah, I can't hear you at all right now. Let's try one more time. Okay, let's see here. Trying to so what about now? Is that better?
Can you try that again?
Is that better? Can you hear me much better now? No? Okay,
Mm-mm-mm.
yeah, if you wanna come out and, head back in, and while you're doing that,
Okay, I'll
go on
do
to hop
that.
off and hop back on because we were having
Okay.
yeah, we had the perfect connection earlier and no problems at all. So as she's doing that, we wanted to talk about Charlotte Mecklenburg schools and an opportunity for parents to hear from our leaders that are leading the Charlotte Mecklenburg School Board. We always do a check, folks, before we actually come on, and we had no problem. So hopefully it's just one of those things that is happening right now. I do see in the note she's saying she can't understand what I'm saying. So we're going to try it one more time. And hopefully, I've got a private check where I can actually give her the questions. And so, if you cannot still hear me, what I'm going to do is put the questions in the chat where we have a private chat and you can answer that. So, because I know your time is valuable, are you able to see the chat that I have right here?
It is still really, really slow. It's like when the record is slowed down.
Oh, yeah, yeah.
But I'm just going to do my best because I've got the questions that you sent me.
Okay, okay.
Um, so I know that you had asked about how many absences we're looking at right
Right,
now.
right, right.
And as of yesterday, we had our student absences were about 10% higher than your typical day.
Okay.
Staff was, boy, we had 1,100 teachers out yesterday,
Mm-hmm.
and we had about 458, almost 460 substitutes who accepted assignments. So with
Wow.
that gap, we've got teachers that are doubling up and central office staff that have fanned out to a whole bunch of schools. Next week, I think you're going to have school board members in schools substituting
Oh,
and
wow.
sort of all hands
Wow.
on deck. Food, the food service folks, we had about 160 absences yesterday.
Mm.
Transportation, our bus drivers, we had about 130 routes where we needed either substitute bus drivers or bus drivers who were doubling up. So parents, if your kids are getting to school late or the bus is late, just kind of bear with us.
Right.
We're running about 15 to 30 minutes late. Some routes have been up to 45 minutes late.
Wow.
So that's the staffing situation. It's really intense right now.
Yeah, and that's unfortunate. So again, that's a great information for us to hear, and people have to be understanding and empathetic. Let's talk about is there a possibility of remote learning? Is that in the future for CMS?
I didn't get that question.
It's just the
Maybe you
second
could put
question.
it in the chat.
Yeah, yeah. It's the next question that I have, which is remote learning. Let's talk about that. Is that an option? I'm just going to go through the questions.
Okay, remote learning.
Right,
Okay,
right.
got that. Yes. So the House and the Senate passed a bill this
Hmm.
past summer that was signed into law by the governor, that changes how school districts can offer remote learning.
Okay.
So last year, you had a lot of districts, including CMS, that for a while there were fully remote for
Hmm.
health and safety reasons. This year, that's not permitted anymore. So
Okay.
what we can do is, if necessary, if staffing gets to such a point that it's not safe, we can close down. We can send a classroom to remote,
Okay.
or even like a grade level, like a part of a school, like maybe fourth grade, or if necessary, a whole school could go to remote. And then that decision has to be made one day at a time. And so thus far, we've had a few of our, pre-K classes throughout the year. We've had a few times where they've had to quarantine the whole class, or also our exceptional students, some of whom are not able to wear masks. Some of those classes have had to quarantine. But with this Omicron surge, we haven't had to like shut down a whole school or anything like that. Hopefully we won't, but we'll just sort of watch and see.
Well, that's good to hear because there was a lot of information about House Bill 654 is what I was referring to. So now let's talk about, I mean, this has to be impacting, it's impacting everyone, but especially our students, the mental health side. What is kind of being offered as far as assistance?
So I think you're asking about mental health assistance. Okay. um, so every school has a counselor. The counselors are still there. And if we've got central office staff who oversee the counselors, psychologists, social workers, they can go into sub if necessary.
Hmm.
So make sure you're talking to your kids, listening to what they have to say. If your child, you know, if you're concerned about your child, make sure your school knows sooner rather than later. Reach out to your counselor, your child's counselor. And then as far as just sort of my mom advice, like mom to mom,
Hmm.
just sort of stay calm around your kids, be reassuring. I know things are stressful and probably frustrating right now, but try not to vent at your kids too
Right.
much about your frustrations with school, or um, and just try to have empathy for the teachers who are working so hard right now, and the front office folks and the cafeteria and the bus drivers. Just try to have empathy. This too shall pass.
It
I'm
sure will.
just hoping and praying, in other countries that got hit with Omicron, it got very intense and then it passed on through. So I'm hoping and praying that's what happens here, but we'll see.
And we can join you in that prayer as well. And don't forget the school board members who are also working really hard. Now, let's talk about what else parents can do to help. You talked about the mommies, but what other suggestions?
So I think you're asking about what parents can do to help right now.
Right.
Um, if your children are young, um, for sure, read to your kids. That's the most important thing you can do academics wise, especially if your kids are in pre-K or first or second grade. Um, in elementary school, the teachers should be sending home a weekly report. Make sure you read those reports and just sort of stay in touch with what your kids are working on.
Hmm.
If no matter what grade up through high school, check Power School again to see if they're missing anything or if any grades are wrong. So that's the best way to be supportive academically. Of course, please don't send your kids to school sick. If
Right.
you think, if it's the sniffles, if it's a fever, just please have an abundance of caution right now. And I know that's tough when people have jobs. I know
Yeah.
that's really tough, but this Omicron is so contagious that just please keep your kids home if they're sick. And there are lots of opportunities to vaccinate, you know, kids and adults, not the littlest kids yet, but a lot of um, if you go to the Mecklenburg County website, there's
Hmm.
an easy way to look up where all the vaccination clinics are. And we're hosting vaccination clinics at many of our schools on weekday mornings. And I will try to drop the link in here for where to find those
Okay.
when we finish this interview.
Absolutely. And I have the information for Mecklenburg County Public Health. So if there's any other additional information so you can close out. And thank you for being a great lip reader as well.
You're asking about additional info, and there, um, I don't know. I don't really have. I think you've asked some great questions. I would just ask for everyone to um, be patient, and just be real supportive of your teachers, and of course our medical workers. I mean, every key industry is very stretched to the limit with all the people out sick right now.
Hmm.
So just let's be patient, let's be kind with one another and empathetic, and just remember this too shall pass.
Great job. Thank you so much. I appreciate her. I say that over and over and over. That's a Miss Elyse Dashew. I wanted to say to her, I put it in the chat. Thanks for being a great lip reader and for making sure that we got this in. I believe they have a board meeting happening. And so she's really busy, and so I'm grateful for people that take the time to just stop in and share this information. I see you hopping on again. Please share your comments. It will show up on the screen as well as we continue to keep you informed as we work together to cancel COVID. I got a good friend that said, girl, you got a whole lot of work ahead of you. And I just laugh because, it's all around this whole cancel culture. How many people actually are always trying to cancel, but we are trying to work together to cancel, although it's pretty well known, or we've got to start learning to live with COVID is the bottom line. It's going to be around from what I understand. And of course, I'm not an expert, but it appears that it's going to be a while. Now, every week I have a great supporter, sponsor as well. Along with Mecklenburg County Public Health, we have Groundwater Solutions. And one of the reasons I like having her as a part of this conversation is because she's out and about in the community and she's definitely informed and she has a pulse on what's happening. Now, what I really appreciate too is they're putting the work in. Groundwater Solutions has been putting the work in for quite some time, and it continues. So, let's start, Dr. Trasha Davis Black. How are you this afternoon or this morning? We're still in the morning.
It feels like I've been here all day. I was here at the office until about 10:30 last night. I was back early this morning. So
Wow.
I am making it. I'm blessed to be here.
Well, kind of give us an update on what you're seeing. That's one of the things that people really appreciate is just hearing, someone that's boots on the ground, out
Mhm.
working, and dealing with people day in and day out. That gives us a really good idea of what's
Mhm.
happening.
So what I can tell you is that lots of folks are experiencing impact for the Omicron variant. There are lots of folks, our lab numbers, our testing numbers are really high. The numbers of folks who are being tested and the number of folks who are testing positive is extremely high. We're still running about 40 to 50% of folks tested who are positive. We're seeing those same numbers across laboratories across the country and across the hospitals. So it's really alarming, the numbers. The good thing, again, is that we're not seeing the severity of illnesses for the majority of the population, but there's still those folks who have pre-existing conditions that are at risk that we all have to be very, very careful about.
Well, I've heard a lot of people say, this Omicron variant is spreading like the cold.
It
And,
is.
it just,
I
yeah, it gets
think
in your,
even more than the cold, Tanya. If you
yeah.
are in the same room with someone, if
Hmm.
you are not securely masked, then it is very likely that you're going to be contract the Omicron variant.
But now, Dr. Black, for people that once you get it, obviously, or it appears if you're vaccinated, the
Mhm.
impact or the symptoms are not as severe. But once you get it and it passes on, that also helps to build up the antibodies in your
It
system.
does. You have antibodies. Once you fight an illness, your body will naturally produce antibodies. And so, for example, I have a family where most of the folks in the family were impacted and were positive over the
Mhm.
course of Christmas and New Year's. And so we
Oh,
have folks who are saying, well, I'm now negative. Do I need to how protected do I need to be from the folks who are still positive? And I'm
right.
telling them to take the same precautions that they would normally do. Uh, folks who are positive should remain isolated, but those folks who are now negative have a really high immunity right now. They have the antibodies. Those antibodies are not going to last forever unless they're doing something to boost their immunity, but you do come out stronger on the other side once your body has fought it.
Dr. Trasha Black, Groundwater Solutions. So I sent you the note because we went through it
Mhm.
as far as my household. And I
Mhm.
shared this last week. I was negative. My son was positive, no symptoms, none
Mhm.
whatsoever, just a slight headache. And I want to talk about testing.
Mhm.
Now, tell me if I'm right or wrong, but are the tests not supposed to be free?
They are not free because the laboratories have to be paid. So individuals don't have to pay for the test, but the test does have to be reimbursed by someone. And so,
Okay.
early on in the pandemic, there was an order that insurance companies would be required to pay for COVID-19 testing. And for those who are uninsured, there's a federal portal called HRSA, HRSA. And a lot of the aid to the states and COVID relief funds come from HRSA. And so HRSA also covers the testing for anyone who does not have health insurance.
So I got a bill for my PCR test, and I have insurance. And I sent a note back and said, why are y'all charging me for this test? Now, are they supposed to file it with insurance, or am I supposed to file this?
Well, I can't speak to that. I can
Okay.
tell you that the labs that I'm familiar with, we bill directly to the insurance company or to HRSA. Now,
Okay.
some doctor's offices, if you can imagine, think about going for a regular office visit.
Right.
Sometimes they will send you a bill directly, even though they have billed the insurance company. And it's just
Okay.
letting you know that this is an outstanding claim. The charges are due, but they should, on their end, be filing it with your insurance companies. But some doctors don't file. They don't have a billing system, so they will ask you to go back to your insurance company for reimbursement.
So that's why you're everything COVID, everything community. And when I got that bill, I was like, oh no, wait a minute. I thought all of this was free.
Yeah,
So
let me ask Dr. Black.
yeah, because I'm trying to figure out. I'm just always bugging you. But I wanted to share, I just saw where there is now a proposal, or effective January 15th, if you have private health insurance coverage or covered by a group health plan, you purchase over-the-counter COVID-19 diagnostic tests. If it's authorized or approved by the U.S. Food and Drug Administration, that's also supposed to be covered by insurance.
Yes, ma'am. But that also means that community members have to do their research, because not all tests are approved by the FDA. There are lots and lots of tests out there, and the approvals fluctuate. For example, when we began testing, we used a product that was produced in Canada.
Okay.
In December, the FDA said, we're going to use all U.S. products. So we've had to switch over to another manufacturer for the COVID solutions that we use. So, you need to make sure that it's an approved test before you purchase it, especially if you're going to be seeking reimbursement through your insurance company.
Well, I can tell you right now, a whole lot of people are not going to be able to get reimbursed because they're not going to see that. And in all fairness, I think with what people are dealing with, I get it, but come on now. Can you at least help people out with this? So let's talk about all of this testing that's happening.
I have a lot to say about testing.
Okay, so have at it.
I will say most labs that I'm speaking with, they are overwhelmed. We are overwhelmed. Just like Ms. Dashew was saying, we are short-staffed because we have staff members who are out because they're positive. We have their children are positive or have symptoms, and they're not sending them to school. And so we are stretched to our limits. We have throughout the pandemic been running at about a 24-hour. Actually, my lab director said earlier he was running at 32 hours. Within 32 hours, he could typically produce a result. Now we have pushed up to the 48 to 72, and then we've even surpassed that, where it's just overwhelming. We were on average processing 200 to 300 tests per day. We are now throughout Christmas and New Year's processing over 1,000 tests per day.
Wow.
So we're running multiple shifts. We had to utilize sister laboratories to try to get results out, and folks are frustrated, especially folks who've been with us for the last year. They're used to getting a test result the next day.
Yeah.
So we're just asking everybody to be patient. Don't stop getting tested. That's, I don't want folks to do that and get frustrated. I know that StarMed has had some issues. The lines are long, getting results out are problematic. There are system issues. And so I just want everybody to be patient, but do get tested and your results will come.
Well, I saw on Nextdoor, a lot of people were asking, where can we find, the test kits? I had looked online at Amazon, and they had a back order. I don't know if they've improved, but I do and have seen certain places around the city, you tend to be able to pick them up. You guys do testing. Tell people where they can find you, Dr. Black.
So we are out at Indian Trail in the Food Line Shopping Center. It's on Highway 74, Independence Boulevard, directly across from the Harris Teeter Distribution Center. We are also at our office at 5104 Reagan Drive. That is off Sugar Creek. Both are drive-up locations. We tend to have very short lines in the Charlotte office, on Reagan. In the Union County area, it just fluctuates. Sometimes you go and there's going to be a 30-minute wait, and sometimes you can go and there's going to be a 5-minute wait. So we're there. We're also at various locations throughout the city, multiple days a week. We did a huge event at the PAL Center on Oakline with 100 Black men this Saturday. That was fantastic. So we're here. You can call us and we'll let you know where we are.
So I do some work with PAL and they got me the information, but it was a little late. And before, I was doing it twice a week, only once a week. So we've got people watching, and Tyrone Jackson just presented something, Dr. Black, I'd love for you to comment on.
Okay.
He says, but looking at the facts, the conclusion is that PCR tests are meaningless as a diagnostic tool to determine an alleged infection by a supposedly new virus called SARS-CoV-2. And he even cites who said that. And, one of the things, Tyrone, this is a very safe space for everybody to share their opinions. Very safe. And we don't have a problem with that. But when I see alleged infection in front of a statement where we've got over 800,000 who have died from something, we've got here in Mecklenburg County along 198,000 cases, clearly there's an infection, there's a virus. How would you respond to that? Because in my situation, what I've been pushing, and again, I'm no expert, I'm just here to kind of help give information. The PCR is the one that people should be taking. The rapid test, which even the CDC says, if you have no symptoms, chances are you may have to take another test. So would you like to respond to Mr. Jackson?
Yeah, I'll confirm what you're saying, Tanya, about the rapid test. There is an error rate with the rapid test. When you contract a virus such as COVID-19, you're going to begin to build up a viral load, and it will get higher as you go throughout the illness. It will reach its peak, and then it will start to decrease again, and your viral load will go down. The rapid tests have a very low threshold. Meaning that you have to be at a certain viral load before the rapid test will pick up. The PCR will pick up with like a 1 to 2%. If you're that low, it's going to pick up COVID-19. So I don't know about Engelbert. I don't know about that quote, but I will tell you, I'm both at the testing sites and I am also in the laboratory. So I know when I talk to someone and they show up at a site and they have symptoms, or they've been with someone who is diagnosed COVID, and then we get the specimens back to the lab and those folks test positive, obviously there's a connection to the specimen and a positive result. Lots of times we'll have whole cars of folks and everybody in that car will test positive. The laboratory folks don't know these families. They're getting hundreds and hundreds of samples, and the ones who are showing up with symptoms, it does result in positive results. I talked last week that, one of the things that we have noticed is that folks are having symptoms before they test positive, but they all eventually do test positive. So I do believe that the PCR machines are very effective to pick up the COVID-19 and all the variants that are coming out.
Well, I appreciate that comment, Tyrone Jackson. And thank you, Dr. Black, for responding to that. As we close things out, is there anything else you would like to add?
No, just again, to be patient wherever you go, be patient, because we're all struggling with the same thing and trying to wake up every morning with a smile and with brightness in this tough time. And so just be encouraged, everybody. We are going to get through this, and we're going to be better on the other side.
Absolutely. Dr. Trasha Davis Black of Groundwater Solutions and Genesis Project, to sponsors of the show as well. Give out your website and phone number for people to get in touch with you.
Okay. Our office number is 704-596-0505. And we are experiencing large volumes of calls. So again, be patient with us. And our website is www.groundwater-solutions.org.
Thank you, Dr. Black. I appreciate you. We started the new year out together, and I'm so grateful. So enjoy the rest of your day. Keep working. And I'm I got you on speed dial anytime
Okay.
I've got questions. I'm
All
going to put
right.
your website up as well. Thank you. I appreciate you. You got to appreciate people that have a passion and really a heart to serve the community. And again, we appreciate you hopping on for information. I want to also cite something that's really important, and I'm going to try to share this with the screen. If you haven't figured out by now, I'm producing and doing the show. You know, we branched out for the new year. But here is an important report that you certainly might want to check out. It is assessing the impact of COVID-19 on low income households in communities in North Carolina, provided by the Keenan Institute. They have done some deep dive into finding out and looking at the impact of COVID-19 on these communities. You should check this out, do some reading. I'll keep sharing this with you because I think it's extremely important that we are informed, that we're reading, that we know what's happening in our community. This is going to be with us for quite some time. And I think it's super important that we acknowledge that and start addressing some of these issues. So, again, here's the website where you can, the link that is, this is the link where you can locate it. Again, it's a deep dive into the impact of COVID-19 on low income households and communities in North Carolina, which is something great that we all should be checking in and be informed about. Thank you to Ms. Elyse Dashew, the Charlotte Mecklenburg School Board Chair, for taking the time to talk with us and give us an update. She did a pretty good job. We've got a private chat where I could give her the questions as well. She did mention that where she was, she didn't know if she would have enough bandwidth to pull it off, but we were able to maintain that. And of course, Dr. Trasha Black of Groundwater Solutions, always there for us and always helping out. Here is their website and phone number, groundwater-solutions.org, 704-596-0505. A sponsor of Canceling COVID, as well as Mecklenburg County Public Health, mecnc.gov, mecnc.gov, 980-314-9400. Well, it's time for me to move out of the way, my friends. And as always, life's challenges make you better, not bitter. I'm Tanya Rivens. I'm always grateful for you taking the time to join us as we work to cancel COVID. In the meantime, I'm here trying to make sure I sign off in the proper way as well. But most importantly, I just appreciate you tuning in. Do me a favor, share this conversation. Let people know we're here every Tuesday at 11 o'clock. Let people know that we're providing some great information and we're bringing you experts and people, real talk, real resources to keep you informed and keep you prepared. Join me on Saturday. Praise 100.9 FM, Sounds of Inspiration. Spend your Saturday with me from 10 until 2 p.m. I've got tea time and a whole lot of other good stuff to share with you. But most importantly, as we continue to deal with this pandemic, know that together we're working really hard to cancel COVID. Have a great day, everyone. Thanks for tuning in. And make sure you stay warm as you're out and about around the city.